Thanks for sticking with us here on Morning Line, where we're talking about depression and suicide prevention. We're joined by Dr. Seth Banks from TriStar Summit Medical Center. We're just going to go ahead and continue our discussion, but I do want to give you that phone number again. We would love for you to call in 615-737-7587. So go ahead and give us a call while we continue this discussion. So Dr. Banks, is somebody predisposed to, be depressed, or is it a circumstance, a trigger?
I think it's a combination of both, to be honest with you. I think certainly life circumstances can lead down a road to depression, lead down a road to different kinds of psychiatric disorders. Obviously, the more hopelessness, the more loss, the more difficult circumstances you have in life, that can lead to depression. Having said that, there is at least some evidence that there's predisposition to depression. There's not been any definite, depression gene that's been found found in any clinical studies yet, but certainly people who have a parent who has been diagnosed with clinical depression are 4 to 5 times more likely to suffer depression in their lifetime. So there is certainly some connection, some predisposition there, whether it's environmental, whether it's genetic. It's hard to say, but there certainly is at least some evidence of predisposition.
Okay, we've got Mary on line 1 right now. Hi, Mary. How are you?
Yes, hi. Thank you so much for taking my call. I'm just calling because I find this topic very interesting. My father suffered from depression a long time, and he's doing fantastic. He's doing great. He's on medication. But one of the things that bothered him the most was that everyone will always be asking him, "Are you okay?" And once everything was said and done, he felt like we were babysitting him too much. So at that point, we decided to kind of talk to someone and learn how to deal with his depression, because he was dealing with it, but we were not. So that's something I wanted to put out there, and maybe you can talk about that.
Great question.
Absolutely. Certainly there is a fine line between, between being overbearing and between trying to help, I suppose. And I think it kind of depends on the clinical situation. When you've got to obviously know the person well and understand their situation well. When, especially if they're in the acute, throes of clinical depression, people who are acutely suicidal, obviously it's important to check in on them as frequently as possible, if not be there right with them as much as you can and be that support system. But as they come out of it, I think it is important to kind of gauge their symptoms, gauge their reactions to your questions, and kind of learn how to back off and, allow them to do some self-healing as well. There's a fine line, there's a fine balance there, and absolutely, it's very important to keep that in mind.
When people hear, "Oh, that person is depressed," it's like, "Oh no," like as if they can't be cured.
Sure. There's certainly a social stigma to depression, to really a wide variety of, psychiatric disorders. And it's really unfortunate because, like I said before, it's a health issue. It's similar to diabetes or to high cholesterol or high blood pressure. At least in my mind, they're all treatable health issues. And because it deals with the mind, because it deals with emotions, and because we're, brought up to think about things in a certain way, it carries a certain stigma. But I'm hoping that at least through talking about it a little more and, through what we're doing here, is that hopefully it can kind of open some eyes, open some minds, and not make it such a taboo subject or not make it so difficult to approach.
So how do you help a family member who might be suffering with depression? What do you do?
Well, first of all, I think the first thing is to just let them know that you're there for them. I mean, it's important not to judge or not to make blanket statements. When somebody says they're depressed, our first thing is to say, "But you have so much to live for." And when a person is truly clinically depressed, that kind of advice isn't necessarily the most helpful, because they have, as we mentioned before, a chemical imbalance that's telling them, "I don't have anything to live for." Or saying things like, you shouldn't commit suicide because think of what it would do to your family, or, think of all the pain you would cause. Well, when you're in the middle of true severe clinical depression, people aren't necessarily thinking rationally about things like that, and it's not helpful to, make judgmental statements. The most important thing is to say that you are there for them, that, you're willing to do whatever it takes to help them, and offer help, and not necessarily, say, come on, we're getting in the car, we're going to the doctor right now, but, give them some numbers, give them some names of, clinical physicians, suicide prevention hotlines, just things like that. Give them some options and tell them you'll be there for them, and if they need anything, that you'll stand by their side.
All right, we're going to hear from Kelly now. Kelly, thank you for calling us.
Hi. I was diagnosed with depression back in, I think, 93, 94. And the only I was diagnosed is I had been super depressed, I guess, felt like Robin Williams was. And everything had hit me. I couldn't find a job. Just graduated high school. I couldn't find a job. My mom was pressuring me to get a job. Everybody was saying, get a job, get a job, get a job, get a job. Well, I couldn't find a job. I guess I wasn't looking. And I had went to take a shower. And I had my plan was going on motion, and when I was getting ready to hurt myself, my nephew at the time was 3 or 4 years old. He walked in, and the only thing that saved my life was I promised him that I would never leave him.
Wow. Kelly, thank you so much.
And I've been to Summit, and they're awesome. I've been hospitalized about 10 times.
Okay.
And they're awesome at Summit.
Well, Kelly, thank you so much for sharing your story with us. I'm sure that it'll help a whole lot of people. Dr. Banks, let's talk about that, just in terms of, that's a critical point.
That's a critical point, and you're exactly right. And I think that's an important statement to make, is that you never really know what small act that you have how it can impact a person's life. I mean, we don't know what everybody's going through on a daily basis, but it's important, to reach out to those family members, to those friends, especially if you think they're down, but really on any given day, and let them know that, hey, I love you. Hey, I'm here for you. Hey, I'm thinking about you. Those kind of things I think are very important, just like she mentioned with the chance incident at the right time with her nephew walking in. You never know when that phone call or that text message or that just stop by the house and knock on the door and say hi is going to make a difference in somebody's life.
Absolutely. And for those who might be feeling that sense of helplessness or hopelessness, that you hear Kelly, you're not alone, but there is help, and that's why we're here today. Let's hear from Vonda. Vonda, thank you for calling us.
Yes, I'm so glad that you all are doing this. I hate that it's happened because of with all this with Mr. Williams coming out, and it's sad that it has to take something like this to come out. But I have been in depression before myself, and I have overcame that. I'm not completely healed of it, because you cannot be healed of it, but you can overcome it. I was diagnosed back in the 90s, and I myself, if you know the warning signs, you can feel it coming up, and it's like you can either let it have control of you, or you can take control of it.
So how do you take control of it?
Well, I'm also part bipolar, and bipolar is one of those other diseases that is also a challenge to deal with. But you kind of, when you start feeling the symptoms, come on and watch for the symptoms. And just be aware of your surroundings, be aware of what you're going through, be aware of what someone else is going through. Don't let someone else pull you into their web, because you can get to feeling sorry for someone else, and then all of a sudden you may start feeling sorry for yourself because of what they're going through. You can't do that. You have to stand, and you've got to say, hey, I am an overcomer. I can do this.
Fantastic. Vonda, thank you so much.
Catch it early. Catch it early. The earlier it is, the better it is. I've had family to commit suicide. I've had family that have attempted suicide. I have a father that's going through dementia as we speak. But all we can do is encourage them, be there for them, love them through it.
Thank you, Vonda. Really important that you called there. She said a lot of great things.
She certainly did, and I think one thing she touched on that was very important is self-awareness, and obviously that's not something that comes overnight, but people who are going through depression, I think it's important to get into some sort of established health relationship with a physician or a psychotherapist or a psychologist to learn their particular signs of depression so they can head it off early. That's certainly one of the things that we like to promote, is to, learn exactly what your triggers are, what kind of things that cause you to be depressed, and B, what kind of things, what kind of symptoms you have, what are your first signs of going into that depressed state, so you can do something to combat it earlier rather than later.
And she talked about suicide. Kind of, let's transition there.
Sure.
And it really affects especially younger people, 10 to 24 years old. And it's according in the United States alone, someone dies by suicide once every 16 minutes.
Yeah, absolutely.
It's a lot.
It's still one of the top 10 causes of death in the United States. The statistic I read yesterday was that worldwide, suicide is responsible for more deaths than war, than murder, than automobile accidents combined.
Wow.
This is worldwide now, not just in the U.S., but that was a pretty powerful number that I read, to think about all of those things combined, that still suicide outweighs that. So obviously it's a problem. And unlike a lot of things in the healthcare world, we're getting better at treating heart disease. We're getting better at treating cancer. Those death rates seem to have declined over the past, 10, 20 years. Suicide rates really haven't changed a whole lot, which says to me that either we're not doing a good enough job treating it, or we're not doing a good enough job of making people aware that we have treatments for it. So this is just another reason to put this out there and make sure that people are aware.
So we'll talk about that when we come back. That's a great point to talk about. It's just about the treatments and what you can do. Again, we'd love for you to call in. That number 737-7587, and we'll be right back.